colleagues. I'm Christoph Diener from the medical faculty of the University of Duisburg-Essen in Germany. And today I would like to tell you about 5 interesting studies which were published in January 2024. I would like to start with long COVID. There is an ongoing discussion whether this condition, which means persistent symptoms like dizziness, vertigo, fatigue, headache, and so on, cognitive impairment, persist for more than 6 months, are either really a consequence of the infection or are functional symptoms, or this is a psychosomatic disease, or it's a depression. And there is one important paper which came out in Science, and the group here investigated 39 controls and 113 patients who had COVID-19, and at 6 months, 40 of them had long COVID. And they measured repeatedly more than 6,500 proteins in serum. And the patients with long COVID had a significant increase in complement activation, which persisted even beyond 6 months. And these patients also showed increased tissue lesion markers in the blood and activation of the endothelium. And also they had increased platelet activation and autoantibodies with increased anti-cytomegaloly and anti-Epstein-Barr virus immunoglobulins. And these are very strong indicators that COVID leads to long-term changes in our immune system. And different activations of complement factors could explain the variety of symptoms that these patients display. Now, whether this has consequences for treatment is unclear at the moment. Well, let me come to another issue, which is the future treatment of Parkinson's disease. A paper in Lancet Neurology, and I think you are all aware that at a time when patients display symptoms like rigidity or bradykinesia or tremor, it's most probably too late for neuroprotective therapy because 70% of the dopaminergic neurons are already dead. And the authors propose a new biological diagnosis of the disease in the preclinical state. And this early diagnosis, preclinical diagnosis, has 3 components. One is to show the presence of synuclein either in skin biopsy or in serum. The second one is proof of neurodegeneration either by MRI or by PET imaging. And the third one are genetic markers. And on top of this, we know that we have preclinical manifestations of Parkinson's disease, like REM sleep disorders, like autonomic disturbances and cognitive impairment. And I think with this new classification, we should be able to identify the preclinical phase of Parkinson's disease and include these patients into future trials for neuroprotection. My third study in the New England Journal of Medicine deals with a very rare disease. It's Niemann-Pick's disease. This is a rare autosomal recessive disorder which has impaired lysosomal storage. And this disease, which manifests usually in childhood, goes along with systemic psychiatric and neurological abnormalities, in particular ataxia. And until now, there has been only one therapy with miglustat, which has a lot of side effects. Now, the group of authors found a new therapeutic approach with N-acetyl-L-leucine, which primarily increases mitochondrial energy production. And this was a small placebo-controlled crossover trial with 2 times 12 weeks. And this new compound showed efficacy, was very well tolerated. And this shows that we definitely need long-term studies with this new well-tolerated drug in this rare disease. Now, my 4 studies comes from the stroke prevention field. And this is a study which was published in the New England Journal of Medicine. I think you are aware that we have something which is called subclinical atrial fibrillation. And these are high-frequency episodes in ECG, usually identified by pacemakers or monitoring ECG monitoring systems. And this study international study, included more than 4,000 patients, the Artesia study, and randomized these patients either to apixaban 5 milligrams twice daily or aspirin 81 milligrams. Now, after 3.5 years, the investigators showed a small but significant decrease in the rate of stroke with a relative risk reduction of 37%, but also, unfortunately, a significantly increased risk of major bleeding with apixaban. And this means that we need a careful discussion with the patient, the family, and the GP to decide whether these patients should be anticoagulated or not. And my final study published in Cephalalgia deals with the comorbidity of depression and migraine. This study in the Netherlands included patients, and 108 of them were treated with erenumab and 90 with fremanezumab, and 68 were controls. And they used 2 depression scales. And they could show that the treatment with the monoclonal antibodies improved at least one of the 2 depression scales. And I think this is an important study because it would indicate that you can improve comorbid depression in people with severe migraine, even if this study did not show a correlation between the reduction in monthly migraine days and the improvement of depression. So what we learn for clinical practice, we have to identify depression in people with migraine, and we have to deal with it, whether it's with the treatment of monoclonal antibodies or antidepressive therapy, doesn't really matter. Dear colleagues, we had interesting studies in this month. I think the most spectacular one was the ones in Science on long COVID. Thank you very much for listening and watching. I'm Christoph Diener from the University of Duisburg-Essen.